Hi everyone, welcome to the second episode of the Unity Network. I'm Zach Chen, your host. I'm a rising senior at Boston Land School. And today we're joined by Rishabh Ranjan and Gopal Tadinada. Thank you guys for joining me today. So, Rishabh Ranjan and Gopal Tadinada at ISEF 2023 won the Fundamental Research Award of $10,000 for building a custom automated system to detect gastrointestinal cancer before serious symptoms appeared. So, can you guys just give a brief introduction of your project, how you guys came up with it?
Yeah, so actually, the previous summer, so this project was a continuation. So 10th and 11th grade, we did this project, and uh, I'd say the summer before 10th grade, we both volunteered at the Brown Cancer Center, and one of the things that we kind of noticed there was just the volume of pancreatic cancer patients that were going into hospice,
Mm-hmm.
like directly. They would be like the cases would be detected much too late, and so at that point, no sort of the tumor would already be metastasized or like spread to all the other
Right.
organs, and so there was nothing that many of like the oncologists or interventional oncologists there could do. And so that's one thing we noticed, and so we were able to identify that the key step that needs to be taken is really just identifying the cancer in the early stages.
Yeah,
Sounds
and so
good.
in order to do that, we looked at some non-conventional ways to detect. First, it was pancreatic cancer. So most current tests are like image-based, so like CT
Right.
scans and MRIs and stuff like that. We kind of pivoted away from that and looked towards another approach, which was blood-based biomarkers. And so this method was already proven for a couple of other cancer types, such as resectable lung cancer and bladder cancer. So after doing a heavy amount of research and literature review, we identified some biomarkers that are correlated with pancreatic cancer first. And so that kind of like guided our direction in how we actually want to detect these cancer early. So down the line, in essence, what our project does is it's a low cost device that is portable, and what it does is looks at a single blood sample, so from like a finger prick that you take at like your doctor's checkup like annually, and it looks for a panel of 12 microRNA biomarkers. It quantifies them from this blood sample, and then those 12 levels get inputted into a machine learning algorithm, which then classifies whether a patient will have one of three gastrointestinal cancers, whether it's pancreatic cancer, colorectal cancer, or hepatic cancer. And so that's in essence what the project does.
Great. Thank you for the explanation. So, was there like any hurdles that you encountered? I know machine learning, how it requires a lot of data. Was there any like challenges like that you guys faced?
So actually, I wouldn't say many of the challenges were in the machine learning part. I feel like the machine learning part, I'm doing more. I'm doing more like projects and things related to deep learning, and so I would honestly say the use case here for machine learning wasn't really complex. It was just kind of like 12 input values, and then you would just use like one of the many classification algorithms, like pattern recognition classification algorithms. So I wouldn't say that part was very tricky, but I think what really was like tricky for us was the actual device that we developed to quantify the biomarker levels in the first place. And so one thing that like specifically that was very like difficult for us was the optical system, and it was basically ensuring that whatever was happening within the device, like how we're quantifying the microRNAs through fluorescence. Basically, we used like a fluorescence-based approach by measuring, how much or like the random fluorescence units that are being emitted by each of the 12 samples, and then building like a standard curve with that. So that's one of the methods that we used. And so being able to use like a cheaper camera than what traditional 96 well qPCRs do, that was like pretty difficult for us just because across uh you know so we used like Arduino, and one of the things with Arduino is that it's like memory size. It's not very good for handling images. There's only one kind of camera that's really compatible with Arduino, and then being able to do image analysis on that, like an automated image analysis on that through the Arduinos, like it's very difficult, and oftentimes like the program would crash. And so we had to develop a way where we actually loaded the image. We used Arduino to capture like the image, but then we transcribed all the pixel values and reconstructed the image in Python, and then did image analysis that way. So that was one like really specific thing that was pretty difficult because we had to build our own custom library and modules for that.
Yeah,
Okay.
and
Yeah.
stats for that like much more like specific example. I would say that just a fundamental challenge we had across all aspects of the project was obviously two high schoolers doing this from home. We
Right.
started when COVID was still like somewhat big, and so a big difficulty was at times getting access to certain resources, which would probably speeden up our process a lot. And so, I mean, fortunately, we live in a time where the internet is very,
Yeah.
fruitful when it comes to things like that. But in the beginning, some of the hurdles we did encounter were just getting around not having initially access to a lab and
Mhm.
trying to figure out what we can do from home while still making a pretty meaningful impact.
Great. Yeah, I'm glad you brought that up because that's definitely the mission we want to bring forward. Allowing people to access, resources or labs that they otherwise couldn't. So yeah, great response, guys. So I know your new product you guys developed is only $300, right? So what's the future plans for your project? What are you gonna do with it coming forward?
One thing I actually learned here, like at the internship that I'm doing right now, is a lot of medical things, like any sort of device that's actually in medicine, you would probably take the cost and multiply it by like maybe 100, right? Like
That's
things
fair.
in like medicine or anything that's medically approved, it costs like that much more. But I would say definitely the next step with what we're trying to do is to get a patent on specifically our optical system that we developed. And then after we get the patent, we're thinking how can we get like more reproducible like results, like going in like testing with like real patients and then getting results that way, which can be validated like further than a more theoretical setup, which was
Yeah.
what we had before.
And another thing that we want to focus on is taking technology similar to this. And so by technology, I mean like methods of using genetic biomarkers within biofluids and using that kind of pipeline to detect maybe a couple of other diseases. Because I mean, fundamentally, everything comes down to those small differences in DNA and RNA. And so a majority of diseases will produce some sort of like genetic trace or biomarker trace which can be picked up. So what we want to do is we kind of want to make this the scope of this project a lot bigger by also making the device applicable to a plethora of different diseases, whether it's just other cancer types such as lung cancer or even like other infectious diseases such as, I mean, we've had our eyes on a couple of infectious diseases such as Legionella, Legionnaire's disease, Zika virus, cholera, several of those diseases where the low cost would really make a big impact when it's in like third world or developing countries, where a lot of those infectious diseases are a lot more prevalent than say, cancer. So we want to expand the scope of this and see, what other communities and other diseases can make a difference in.
Yeah, that's definitely great to hear. I can't wait to see what you guys do with your project coming forward. So let's go to this idea of, ISEF, right? So you're at this week-long competition. So you guys just like get this first place award. You guys are pretty stoked, right? So then you're caught up for like this huge award, like this $10,000 award. How did it feel being caught up there? What were your like initial feelings and reactions?
So honestly, at first,
Actually a funny story.
huh?
Right, this is actually a funny story.
Pretty funny story. So, so before we getting the top grand, like one of the top 6 grand prizes, we got like first place in our category, right? So we went up to the stage and we're sitting on the podium and and we were honestly pretty stoked after that. Like we were happy enough because we thought, like, okay, that's good. Like, we were
Yeah, sure.
it after that point you can't really bank on getting another award, but that's pretty big in itself. So we were pretty happy after that. But then as we're standing there at the podium and they're announcing the top 6, they go through 2 of them, or no, the top 8. They go through 2 of them, and those 2 were honestly the ones that if we won, I was expecting it would be one of those 2
Hmm.
or one of those 3. I believe it was like the Craig R. Barrett Award and the Dudley Hirschbach, the Nobel Prize one.
And then the EU one as well.
yeah, so they go through those awards. We didn't get any of them. So then, once they're talking about the Robert Horvitz Prize, I whispered to Gopal's ear that there's no way we get this one, right?
Yeah.
And he's like, yeah. So then I'm not really paying attention to who they say wins. I'm just like, all right, whatever, right?
Hmm.
But then when they said in the category of biomedical engineering, I was like, oh wait, yeah,
Yeah.
I would have just like been wrong. And then obviously they said our names. We obviously there's a sense of like disbelief for a couple of minutes.
Sure.
You don't
Yeah.
really know what's going on. You just know something happened and it was big. And then I think it really set in for both of us when we were like leaving ISEF and like coming home. That's when it kind of just hit us that like this is a pretty big deal. Yeah.
Wow.
Yeah,
Yeah. Great
I actually
story.
had my mom forwarded me a clip on WhatsApp of like my grandma actually watching from India. They put it
Oh, I
on
think
like
I
a
saw
big
that. Yeah.
yeah.
Yeah, that was a good
So
reaction.
that's the moment I was like, oh, like
This is
you know
global.
we like want that or whatever.
Yeah.
Yeah, I think for me it was when I opened my phone and I had like 200 like missed
Oh, wow.
notifications and like I don't know how many missed calls. So I was like, oh wait,
Yeah, it's big. It's big.
that's pretty big.
Yeah. Once again, congratulations for that. So after ISEF, what have you guys been up to? I know I talked to Gopal a little bit, and you are currently at Rise, which is awesome. So for both of you, like, what are you guys doing, right now?
So I know both of us, our journey in research has just started, and this was just a good step. This was just a good first step in the right direction, and so we. I'll speak for myself first. I'm still continuing to do a lot of heavy cancer research, specifically and related to metabolism in certain cancer types like lung and breast cancer, and I'm doing some genetic engineering for some alternative projects related to that. And then I'm also doing a lot of computational work related to, and this is probably more related to this project, but it's related to actually examining epigenetic patterns in patients with blood cancer and myeloma. And so that's using some more heavy like Python code stuff, which is another thing I'm working on right now. But I think I speak for both of us when I say this that in the future, we definitely want to focus a lot on translational medicine and not only doing research, but taking innovation and bringing it to the real world, taking
Okay.
innovation, bringing it out to actual hospitals and clinics, which I think is a gap that's pretty big right now. And so I think in the coming years future, that's something I really want to work on, is actually taking inventions and technology from bench to bedside and enhancing patient experience through the application of technology.
Yeah. Yeah, so you already said I was at like Rise, or I am at Rise, which is one of those summer research programs. So I think Rise, like as an experience, it's been pretty fun so far. But specifically about the research, I doing in this research. So I'm in a lab where they're specifically focusing on like surgical robotics, which is like they're trying to make intra operational or like interventional robots that can be used during MRIs. So I think currently what they're working on as a lab is this prostate robot that uses like cryoablation
Hmm.
to be able to kind of kill off tumors like prostate tumors. And so I'm working. That's the overall objective of the lab. And so I'm working on one of like the smaller projects there, which is creating like a feedback loop for that like robotic system.
Okay.
And so far, like the work has been pretty difficult. I think I'm probably going to have to go into like the lab tomorrow. I
Hmm.
think there's like a beach trip planned. Like Rise has planned a trip to the beach, but I'm pretty sure I'm gonna have to like skip it because
Oh, unfortunate.
yeah. But I mean, the work has like definitely been fun though. I'd come back of like from the internship and I'd be actively thinking about like new ways to get what I like wanted done at the internship. So yeah.
Okay. Yeah, awesome. Great to hear that. So sort of similar question, but extending that, what is your like long-term goals, maybe in research or just after high school, what do you guys plan on doing?
Yeah, so I don't know 100% about like academia and doing, different like, becoming a researcher and writing papers, but I think I actually got like kind of interested in the role that my PI has right now, and that he's actually like doing private contracting with some companies
Okay.
in which
Yep.
he's developing like medical robots for those, like he's part of the research team that's like developing medical robots for those companies. And I think like taking more of an entrepreneurial route into into the, I guess, field of like biotechnology and surgical robotics is definitely something that I wanted to do. Like I find that part extremely interesting.
Awesome
I
to hear
think
that. Yep.
Yeah, and honestly, I have a pretty similar route in mind with Gopal. I've kind of set my eyes on more of like an entrepreneurial role where I'm not necessarily 100% dedicated towards the practice side or the research side. But as I said earlier, bringing certain lab research to actual clinics. So that's something I want to work on, whether it's through immunotherapies or certain like new pharmaceuticals, or things that are like biotechnology related. My big goal in the future is going to be certainly, working on bridging that gap between research and clinics. Yeah.
Awesome. So last question before we ask you guys for some words of wisdom. Outside of research, what is your high school life like, or what do you do in addition to research?
Um,
yeah, you can go first.
all right. Okay. So, in addition to the handful of academic stuff that happens in um, high school,
For sure.
as you can tell right there, I play the guitar a lot. Um,
Awesome.
Currently working on making a YouTube video, so I'll let you
Okay.
guys know.
For
Um,
sure. We might
play
put the
guitar
link
a lot.
below.
Yeah, we get some YouTube clout. And then pretty big sports fan. Um, whether it's basketball or football, NBA, NFL, pretty big sports fan. And then I love listening to music, just like being like a fan, I guess you could say. So I listen to most genres, like not country, but most other genres.
Not country.
Um, and then just like sleeping, chilling,
Okay. Yeah, for
making,
sure. I love sleeping
just
too. Always
yeah,
taking the
sleeping.
naps.
Sleeping's always non-negotiable. Actually, it's pretty negotiable, but it's just always preferred. And cooking, eating,
Oh,
both of
for
those things.
sure.
Not the
Yeah.
cleaning, but only the cooking and eating. That's it. That's my life outside of academics.
Good to hear.
Yeah. Yeah, I play like basketball a lot.
Okay.
I think I've been playing a little too much. I brought like one pair of shoes here, and there's like holes in my shoes now because
Oh
of
my
how much
God.
I played. But yeah, I play a lot of basketball. We actually had a tournament
Oh, at
this
Rise?
Wednesday. Yeah,
Oh, that's cool.
yeah. Yeah, we did all right. Uh, I'm not going to say who, but someone on our team ended up missing a wide open layup to win the game.
Oh
But
my God, no way.
yeah,
Any favorite players, you guys?
Trey Young. Trey Young's
Trey
definitely
Young?
my yeah.
Good
Trey
pick.
Young's my favorite player. He didn't have too great of a year, or he didn't have a great season this year. But I mean, I'm ready for, I guess, his revenge season.
Yeah, for
This
sure.
I also listen to music, and I eat a lot. It doesn't really reflect, but I eat like a lot. I have like a cereal bowl right next to me actually.
He does eat a lot. I'm kind of jealous because he eats a lot, but he doesn't gain weight.
Ah, yeah. That's definitely something to be jealous about. Okay. Okay, now we're into the advice section, I guess. So the first question I have for you guys is for people who are like trying to into research, if there's no labs nearby, what's the best way to get started into research?
Um,
Yeah,
well,
you can go ahead.
so I mean, there was a time in science, especially biology and chemistry, where like lab stuff was almost like required. But from my experience, like even when you're in a lab, like nowadays in those lab heavy fields, a lot of the work done there can be computer based sometimes, especially since a lot of things are becoming like genetic and epigenetic now. I mean, when it comes to that work, most of it is online and public, right? So whether it's through like the NCBI or the NCI or a lot of those big like government organized, like institutes and websites, there's a lot you can do with that in just like using that with like obviously computer science and stuff like that, and instead of necessarily relying on like lab tests such as cell culturing and whatnot, right? But I would say definitely like look into like what's new in the field of like genetics and stuff like that, just because people oftentimes now think that you have to get into a lab, but a lot of lab work is done on computers anyways. Okay, so just look into like how you can use technology and combine that with like whether it's synthetic DNA engineering or something like that, and then also read as many papers as you can to get ideas. Just like look at all of the recent Nature articles and stuff like that, and who knows, you may discover a new passion that you can do from home, whether it's like engineering or physics or something like that.
Yeah, good advice.
Yeah, I'd say first step for research, I feel like research as compared to maybe other things that people might be interested in like in high school, I think research is one of those where you really can, I guess, pave your own path in terms of what you want to do. Like it's something where you can take a passion project and really like you can really do something as a passion project in research. And at that point it's not really like, oh, I'm doing work, I'm actually like having fun doing this research. And sure, at times it's frustrating and things, but I think the first step is to definitely follow your passions. And so yeah, like Rashab said, a lot of the things nowadays, I mean, with like the AI like revolution and everything, there's a lot of things that you can do online now. You can definitely do a lot of online projects. I know many people, like many high schoolers, are getting like publications with pure like CS and AI projects, like by just training models at home and things. And so there's definitely like a lot of room right now to do very like key AI researcher. Yeah.
Yeah, for sure. All right, the last question we have today is, so there's definitely a lot of technical skills. Um, wait, does it pop up? Okay. There's definitely a lot of technical skills involved in research, right? You have like neural networks, statistics, computational biology. Is there a good way to learn like skills necessary for your project? And if so, what is that?
So on the statistics side, um, the biggest thing I would say for statistics, and if you're looking at ways of analyzing your results and what they mean, is it's one of those things where it's so common that every other researcher published paper has to have a decent amount of statistics in order to be published, right?
Right.
So whichever field you're in, whatever project it is, look at similar projects in similar fields and just go through those journals. Go to the results analysis section and look at all the different statistical tests that they're doing. Me and Gopal definitely did that, and we looked at what other methods are people using aside for the conventional p-value and chi-square test, right? We were looking at this person's using this, or like just like the different tests that they're doing for projects that are similar to ours and results that are similar to ours, right? So for statistics, it's mainly just about reading, going out and seeing what other PhD level researchers are using to get accurate data analysis, and then from there it's pretty easy. Stats is pretty easy to learn, honestly. YouTube videos and articles and all those pages will get you covered, and Excel will do a lot for you from there. But if you're trying to figure out what to do with statistics, just read through any project that's similar to yours and has done well, and see what they're doing, and try to use some of those similar tests for yours to get good data.
Yeah. So regarding like the skills and things that you have to learn in order to, I guess, do projects, I think I think you can learn skills honestly as you go along with your project. I think if you're passionate enough, you're going to be able to basically tackle these kinds of problems or things that you run into when you're doing your project itself. I would say like before we started our project here, we were like we were decent at Arduino and the robotics side of things, 3D printing and those things. We had basic skills in those, but in terms of like applications and extensive applications of those things, like this project definitely helped us with that. I remember like we had to go through numerous design iterations, and we used like this free hub at our like local university to 3D print things, and like we took the same, like we showed up week after week printing out like the same part because it stopped. It wasn't like working with
Right.
our with whatever design we wanted, and the guy that was like printing the part, he said he got our emails like in spam. He made it from the Google form because of how many times we submitted it.
Nice.
Smoke detector went off many times in our house.
I believe
We
it.
we blew up far too many transistors. Probably inhaled a lot more smoke than it's healthy. Um, so we, by
All
no means,
part of the process.
yeah, but by no means were we experts in this before we began. And I'm generally stronger when it comes to biology stuff. But in this project, I'll give some praise to Gopal that as it went along. I mean, he learned so much about, you know, all of these different things that in the beginning he had no clue, what it was. In terms of like actual cancer, like hard cancer, medicine related stuff. So yeah, you just trust the process, figure things out as you go, troubleshoot. The internet's always a great resource, and you'll figure it out. Like don't be worried of like, oh, I'll have to learn this, or oh, I don't know, I'm not an expert at computer science yet. Before you start it, because then your limitation is just it's just a delusion, right? So you know just that shouldn't be a reason why you don't do something. Just start it, trust the process, figure it out as you go. Reach out to people that are smarter than you are. There's something wrong, and ask for help, and it'll be good.
Yeah, for sure. It's all about the journey, and like definitely with over time you get more experience, and I mean even then you're still always learning. Yeah.
Yeah,
So thank you again, Rishabh and Gopal, for joining me today. It was fantastic to have you guys on. And that concludes our interview. So thank you so much.
yeah, no worries. Thank
Bye.
you.